Thank you, Lesroy. Good evening. In late December, we shared publicly our optimism in our fight against COVID-19, despite the fact that we were in the throngs of our fourth wave. We said then, with the high immunity threshold from the vaccinated adults in the Federation of St. Kitts and Nevis, coupled with immunity acquired by some from previous infections, that it was highly unlikely that our hospitalizations and deaths would ever reach the levels seen in previous waves. Deep into our fourth wave, recoveries now consistently outpace new infections, and we are seeing a precipitous drop in our active cases. We climbed from 23 active cases on December 23rd to a high of 1,360 cases by January 14, and we are now down to 553, as was reported yesterday, and I expect that figure to further fall when the figures come in this evening. Hospitalizations from COVID in the Federation are down, and those hospitalized are stable. All the departments at the hospital previously affected with sick-outs from COVID are back to normal functioning, as most staff members have recovered and are back out to work. Consequently, our healthcare system has not been overwhelmed thus far. Now we remain cautiously optimistic as we approach the second year anniversary of the COVID-19 pandemic in March, that we will finally all be relieved of the stranglehold that the virus has had on every aspect of our lives, as Omicron is fast becoming a game changer. 2 months after Omicron started to spread uninhibited across the globe to become the dominant strain, we have learned, 1, that this variant is highly transmissible, 2, it presents less severe disease and a lower risk of death, and 3, this strain is also associated with a 66 to 80% reduction in the risk of hospitalization, especially in populations with a high vaccination threshold. Therefore, the level of concern we had compared to other strains is lessened. Nonetheless, we must still remain vigilant because Omicron, with its high level of transmissibility, may eventually infect us all, knowingly or unknowingly, and still has the capacity to overwhelm health systems and kill the unprotected and the vulnerable. We have been spared the worst thus far and are fortunate in a way to have had the Omicron become the dominant strain ahead of the arrival of the more deadly Delta variant in our community. So where are we now? The vaccinated may continue to get breakthrough infections and will most likely recover, which we have been seeing happening here, with little or no problems, but will have an extra level of immunity. The unvaccinated continue to be at greater risk of severe disease, hospitalization, and death, and those at the extremes of age with pre-existing conditions will remain most vulnerable. We have, over the last 3 days, added a total of 5 deaths from COVID, most elderly, all unvaccinated, with pre-existing conditions. This overemphasizes the need for us to be our brother's keeper. We continue to encourage all to get vaccinated to protect themselves and those around them. If you choose not to get vaccinated and get infected, you remain at a significant risk of having severe disease and dying from COVID-19. If you do survive, you remain at higher risk of getting reinfected and still at risk of having severe disease and dying from COVID-19. The stark reality is that COVID-19 will continue to have a presence in our communities, but one that we should not allow to disrupt all of our everyday lives, as was the case in the earlier months of this pandemic. Its presence also does not have to be a death sentence for anyone. We have the tools to change that individually and collectively. So what is the way forward? The way forward now depends even more so on the individual choices we make rather than the imposition of restrictions and gatherings, curfews, and lockdowns by governments. We must remember, however, that the individual choices we make affect others. As governments across the globe begin to retract the imposition of strict COVID-19 protocols to control viral spread and place more responsibility in the hands of the individual should know that they are responsible for wearing a mask in public and frequently sanitizing their hands, for being responsible for limiting their exposure when they go out in mass gatherings by keeping a safe distance from others, and they should be encouraged to get vaccinated and boosted as indicated. We should now start to pivot to a near free movement of people internally. The rest of the world will be preparing for an opening, and we should be preparing for that opening too. With the current trajectory of our increasing recoveries and decreasing number of positive cases, we should be out of this wave by early February. We have fought a good fight over the last 2 years with significant success. Over the 2 years, we have successfully contained the virus. We have limited hospitalizations and death. We launched a successful vaccination program and had an unprecedented high adult coverage of 82% with one shot and 76.4% fully vaccinated. We have had successful events in the middle of the pandemic, general elections, CPL, Carnival, Under-19 Cricket World Cup. We reopened our churches and schools, and we started the manufacturing, hotel and tourism industry. It is time for us to continue moving forward. The best way moving forward is having the best protection through vaccination and having our immune systems boosted once we qualify for the booster. This is the best route to the near-free movement of people and mass gatherings we had in the pre-pandemic era. Therefore, everyone who can be vaccinated need to make that choice of going to the clinics to get the protection needed so that we can get back to a sense of normalcy. I make this appeal to all of our adults and to all those in charge of our children between the ages of 12 and 17 who still remain a significantly under-vaccinated group. Those who choose not to be vaccinated will have to accept the consequences of their decisions. It is my hope, however, that we all make the only logical choice based on scientific evidence and fact, and that is to get vaccinated to be protected. Thank you.